Welcome to session 48 of the Falcon Physician Review Series online. This last segment of the head and neck, we're going to be looking at the 5 regions, each of which have 5 nerves to distribute to them. Let's get started. First of all, we'll start with the orbit. We've done a little bit on the orbit already, but let's look at some of the organization of the orbit and look at how these nerves are distributing. If you really know 2 things about an orbit, that there's a handful of nerves associated with it, there's your 5 nerves. And if you know that their lateral rectus is done by cranial nerve 6, the superior oblique is done by cranial nerve 4, and all of the other muscles of the orbit are done by cranial nerve 3, then you basically have the entire orbit organized. Let's look at which handful of nerves there are distributing. Really, all you need to be able to do to know the nerves of the orbit is be able to count from 2 through 6. So the handful of nerves are cranial nerve 2, 3, 4, V1, and 6. Then we have cranial nerve 2, which is supplying sight, cranial nerve 3, which does 5 of the 7 muscles you want to think about, as well as parasympathetics. Then you have cranial nerve 4, which does 1 muscle, the superior oblique, and cranial nerve 6, which does 1 more muscle, the lateral rectus. I have not included V1 because that's the sensory portion, and it's as easy as 1, 2, 3 NFL. So we have a handful of nerves associated with the orbit: 2, 3, 4, 5, 1, and 6. If you take cranial nerve 2 and drop it from the pattern, you'll be left with 4 nerves, all of which pass through into the orbit through the superior orbital fissure. When you add back V2 instead of cranial nerve 2, you have 5 nerves again, and all of these will be the nerves associated with the cavernous sinus. Here, cranial nerve 3, 4, 5, 1, and cranial nerve 6 are all passing through the superior orbital fissure, and if you add back V2, you have V2, 3, 4, V1, and 6, all of which are associated with the cavernous sinus. We've already looked at the extraocular muscles, and this is just a reminder of the organization, that of the 7 muscles, 1 is to the lid, 6 are to the eye itself, 2 of which are obliques, and 4 more which are recti. So we have our first region with 5 nerves, the orbit. We have our second region with 5 nerves, which is the cavernous sinus. What are the 5 nerves? Cranial nerve 3, 4, 5, 1, 5, 2, and 6. So there we have it. We've got 2 places with 5 nerves: cavernous sinus and orbit. Let's do a question. A 17-year-old pitcher arrived at the emergency department after being hit in the face by a baseball. Where did the blood from the area in which it is located in this image enter into the nasal cavity? So what you can see is that the maxillary sinus is filled with blood. And how would this maxillary sinus drain into the nasal cavity? Well, it's going to have to drain through one of the 7 openings that enter into the nasal cavity, and we'll discuss those in our next step. But the answer to this one is going to be through the posterior aspect of the semilunar hiatus, D. Let's look at the other options in the nasal cavity. Here we see a lateral wall of the nasal cavity that has several features and spaces that we want to be aware of. First, it has a superior, middle, and inferior concha. Remember that the inferior concha is its own independent bone, whereas the superior ones are off of the ethmoid. Above the superior, you have a space known as the sphenoethmoidal recess. Above the superior concha, that sphenoethmoidal recess will have an opening in it. And then below the superior concha, we'll have the superior meatus. Below the middle concha is the middle meatus, and below the inferior concha is the inferior meatus as far as spaces go. Concha is another name for turbinates, depending on what you were taught to call them. Now, all of these sinuses, the paranasal sinuses and the nasolacrimal duct, have to drain into one of these spaces in the nasal cavity. The way I remember them is simply by drawing a nose quite quickly and remembering that if I can draw a 5-lined inverted cross along the same slope as this nose, here you can see by adding the last two you have an inverted cross. This is all 7 structures that will drain into the nasal cavity. The first of which is going to have the superior concha over top of it. The next one is going to have the middle concha, and then skip a couple and do the inferior concha. Now, of the 5 that are in the first row, 3 of the central ones are going to get a comma around it, which would be the semilunar hiatus. The nasolacrimal duct will drain into the inferior concha, and the sphenoid sinus will drain into the sphenoethmoidal recess. The middle 3 are all filled by ethmoidal air cells. So there's anterior ethmoidal air cells, the medial ethmoidal air cells, and the posterior ethmoidal air cells, all of which will drain into those middle 3 of the 5. Now we only have 2 left. The most frontal of them will be the frontal sinus, and the posterior one in the semilunar hiatus will be the drainage of the maxillary sinus. And this opening is set quite high, and some people will get chronic infections where that opening isn't enough to allow drainage, and they can actually pop a hole into the maxillary sinus in around the gums, and that can drain inferiorly at that point. So we have our paranasal sinuses, which are air-filled spaces in the frontal, ethmoidal, sphenoid, and maxillary bones, and they are all lined by mucous membranes, which need to be kept wet. So if you're talking about the drainage of all of these wet spaces, we have the superior meatus receiving the opening of the posterior ethmoidal air cells. The middle meatus is receiving openings from the frontal and the maxillary sinuses. The anterior middle ethmoidal air cells through the semilunar hiatus, and then we have the inferior meatus receiving openings from the nasolacrimal duct. The sphenoid sinus opens above the superior concha or turbinate into the sphenoethmoidal recess. I guarantee if you draw that out a couple times, you'll have the openings of the nasal cavity memorized and functionally at your fingertips quite quickly. Now let's look at the innervation of the nasal cavity, because this is one more region that has 5 nerves distributing to it. Now you can think about the cranial nerve 1 nerve, which is the one that's going to come through the cribriform plate and into the superior aspect of the nasal cavity, and this is going to be picking up chemicals that dissolve in the wet mucosa. If you get a blockage of that mucosa because of the cold that you have or some kind of allergy infection, then you're never going to smell those structures. And that also affects taste, because smell is intimately coordinated with taste. Then we have the ethmoidal branch coming from V1, which is really going to turn into an external nasal after it continues down as well. We have the nasopalatine nerve along the septal wall and the lateral wall, and this nasopalatine nerve will go through the incisive foramen and help with the palatal innervation. Then we need to get sympathetics and parasympathetics into this area as well, because you're going to spend a significant amount of time trying to deal with managing nosebleeds in this area. That's known as Little's area if you're British, or Hesselbeck's area if you're German. Now, where are these coming in from? The sympathetics are coming in on T1, superior cervical ganglia. T1 is the preganglionic, superior cervical ganglia is the postganglionic. They're going to make the deep petrosal nerve, which will run onto the carotid plexus and then come in with the maxillary artery to join into this innervation supply. Then finally, we need something to keep these mucus glands wet, which would be supplied by the parasympathetics via the greater petrosal nerves. So this is our third region with 5 nerves. Our fourth region with 5 nerves associated with it would be the tongue. And there's going to be 1 motor nerve and 4 sensory nerves that are distributing to this area. First of all, we can see that the hypoglossal nerve will be the motor supply for all of the intrinsic and extrinsic muscles of the tongue. Then we have to have general sensation to the anterior 2/3, which is supplied by the lingual branch of the V3. Then we need special sense taste to the anterior 2/3, which will be supplied by chorda tympani nerve, a branch of cranial nerve 7. And finally, at the posterior third, we get the vagus nerve with general sensation, as well as the glossopharyngeal nerve with general sensation and taste. The glossopharyngeal, of course, is 9. Remember, there's a muscle to the tongue and a muscle to the pharynx coming down from the palate. So the palatoglossus and the palatopharyngeus muscles are going to be pulling the tongue up to the palate in cases where it's tensed. So that's our fourth region with 5 nerves. Now our last and fifth region with 5 nerves is the ear. Not all aspects of the ear, but the external and middle ear. We can see that the external and middle ear need some innervation, whereas cranial nerve 8 is going to supply the needs for balance and hearing in the inner ear. So we'll start outside with the pinna of the external ear region, and we'll work on into the external auditory canal all the way up to the middle ear and the tympanic membrane. On the auricle, we're going to have a lobule and an external ear canal, and we need to get innervation to these structures. The tympanic membrane is also going to be important. We have helix and antihelix, tragus and antitragus, and in the middle ear you can now start to see the 3 ossicles with the malleus, incus, and stapes. Now we're going to take that vibration that travels along that ossicular chain and push it on into the fluid-based structures of the middle ear and the vestibular system. The pharyngotympanic tube is going to open from the nasopharynx and help equalize pressure back through into the middle ear. Then we have our vestibular organ, which is going to be for balance, and our cochlea, which is going to be for hearing. As we look to the outside, we're going to look at some of the nerves that associate with the pinna, and then we'll get into some nerves that associate with the middle ear and the external auditory canal. The pinna is going to be innervated by the great auricular nerve and the lesser occipital nerve, which are going to be branches of C2, C3 cervical plexus. Then we're going to have auriculotemporal branches coming from V3 to get into that anterior component of the ear. That will circle around as well. Now we've got to get into the middle ear and the external auditory canal, and those will be done by cranial nerve 10, which will do a segment, and also cranial nerve 7, which will do a very small segment of sensation, and the entire middle ear mucosa is going to be supplied by cranial nerve 9. So we have cervical plexus, V3, 10, 7, and 9, all supplying the middle and external ear. Our fifth region with 5 nerves. As we summarize, let's look at some reflexes. We've already talked about the corneal blink reflex, the pupillary light reflex, and the startle reflex, or the startle blink reflex. Now we want to add in the sneeze, gag, and cough reflex. The sneeze reflex is mediated through the nasopharynx, and the motor component is from 10, the pharyngeal control of the pharynx, as well as the larynx, because you have to generate abdominal and thoracic pressure slam the vocal cord shut to build that up, and then open it to have the air come with the sneeze. The gag reflex is going to be oriented around the oropharynx, and that's going to be innervated by cranial nerve 9, with the motor response again being 10. And finally, the cough reflex, which is the laryngeal control, and that's going to be through cranial nerve 10 and also mediated motor-wise through cranial nerve 10.